Namaste, Happy New Year, and welcome back to SLG Hello Doctor, the reliable bi-monthly platform for health-related factoids. In this episode, we will be talking about the much misunderstood problem of hernias. So here's a condition that's actually quite common, and yet people shy away from talking about it, even to doctors. Also, hernia is generally considered a male issue. But how many of us know that hernias are of several types and some occur in women more than in men? Today, our medical expert, Dr. Tagore Mohan Grandhi, GI, General and Laparoscopic Surgeon at SLG Hospitals, Hyderabad, will be talking to us about all this and more. Dr. Tagore, welcome to SLG Hello Doctor. We are so happy to have you here with us today.
Thank you very much. Pleasure is mine.
Doctor, let's start at the basics. What is hernia and who is most at risk of developing one?
Hernia is, in a common man's terms, is called a rupture. It's a protrusion of an organ through a wall in which it is contained. Basically, if you look at an abdominal cavity as a barrel, and if you put a balloon inside it, and if you blow air into that balloon, and the barrel has got some holes, so the balloon can actually come out through these openings. This is similar to a hernia. Whenever there is a weakness in the abdominal wall, with the increase of the abdominal pressure, you can develop a hernia. That means a protrusion of the contents through the hernia, through the defect, outside under the skin, which is palpable or which is found by the patient as a bulge. And coming to who are more likely to get this type of hernia. Actually, if you look at the hernias, you can broadly classify as two types. One is congenital, other is acquired. Congenital is the one where the defect or where the cause of the problem is there since birth. But it may not manifest at the time of birth. It may come probably at later part of the life at 30 or 40 years. Normally, during development, there is a tube or a channel connecting the abdomen and the scrotum. The testis usually develops in the abdomen and goes down through this channel into the scrotum. So sometimes this channel doesn't close, and through this channel the organs can also, the fat or the intestine can also go through this channel, causing the hernia. So that is a congenital cause. The people who has this patent defect or patent channel likely to develop this hernia. On the other hand, people who have high intra-abdominal pressure, like people with obesity, people with have severe constipation or micturition problems, or during pregnancy, all these things can cause weakening of the abdominal wall and they can predispose to the hernia.
Doctor, what are the various kinds of hernias?
As I mentioned before, broadly in terms of the causes, there are two types. One is the congenital or the acquired, which I already mentioned. And the other type we can classify the hernias, we can call the hernias by the location they are present. Say for example, the hernia which is present in the upper abdomen, that is above the belly button, is called epigastric hernia. Or the hernias coming through the belly button or just around the belly button are called umbilical hernias or paraumbilical hernias. Or the hernias coming as a result of the previous operation. Sometimes people do have previous operations. Over a period of time, the muscle gets stretched and the muscle gets weakened, the sutures become loosened. As a result, a defect is formed. This is called an incisional hernia. Other hernias, again, as I said, depending upon the position of the location of the hernia, whether it's on the side called lumbar hernias and the lower abdomen specialian hernias, or the back sciatic or gluteal hernias. So broadly, either in terms of causes, either congenital or acquired, or in terms of the location, it's epigastric or incisional, or one of the most important causes, inguinal hernia, that is a groin hernia. This is the most common type of hernia. Almost 75% of the hernia cases do belong to this category of inguinal or groin hernias.
What are the typical symptoms that should alert us to the possibility of a hernia developing?
Usually the symptoms of a hernia are quite varied. For example, a patient or a person who's got hernia doesn't know that he has got hernia at all. So that means symptomless on one extreme. On the other end, you can have severe symptoms. The most common symptoms for one can be is a bulge. When I told you there is a weakness in the abdominal wall through which the tissues are coming out, when the tissues are coming out it's like a cauliflower. There is a defect and the tissues are coming out and this intestine or a fat is coming into the fat that is lying under the skin. So as a result, what the patient will feel, you'll feel an intestine or a fat that is easily palpable or easily felt under the skin. So there's a bulge is the first important thing. This bulge over a period of time gets worsens and causes either in initial stages it could be just a simple discomfort, or as pain grows off, it can be like a severe pain. Sometimes the pain is so severe, it's not get relieved by simple painkillers, needing an emergency operation. So that is, patient is landing up in complications. That means the patient needs a surgery at an earlier date than planned.
Doctor, suppose a person feels that there is a bulge somewhere and he just takes it easy and doesn't address it quickly. So are there any complications that develop from them, and what kind of diagnostic tests should he be prepared for when he visits the physician?
In terms of symptoms or complications, as I told you, the patient will have the most important symptoms are the bulge or a pain or discomfort. If it's left addressed, the pain can be so severe. What happens? Actually, defect in the muscle, think it's a cauliflower, it's a stem. The intestines go through the defect and grows out like a cauliflower. At one stage, it can come out and it cannot go back. The patient will not have severe symptoms as long as the bulge is more prominent or the swelling is more prominent on lying down, on standing up position. And when he lies down, the bulge automatically goes back inside. That means the intestines goes back inside. So in this case, it's not a problem. Sometimes the symptoms can be very mild to be severe. The patient says the pain is more or swelling is more on standing up position. But when you examine, you may not actually feel the bulge. In these cases, ultrasound is the first and foremost investigation. Once you diagnose the hernia, if you want to assess this, like the size of the hernia or the location, what are the contents, whether the blood supply is viable or the intestine is viable or not, for you to know these things, you can go for a CT scan. The CT scan will actually help you to address, to define the size of the hernia, the contents, as well as to plan what sort of operation can be done and in what route it can be done, what sort of mesh, or we repair the hernia, which I will address later by means of mesh, what size of the mesh should be taken. All these things can be known by means of a CT scan. But for diagnosis, simple clinical examination and ultrasound is more than enough.
Doctor, can lifestyle changes reduce hernias once they occur, or do all of them need medical intervention?
In lifestyle changes, I think you are talking about like exercise or something. Usually exercise or anything that is causing pressure in the abdomen wall will actually worsen the hernia. The hernia as such, because it's a structural defect, it's not a medical problem where you give some medicine and it gets better with the medication. This is a structural problem. There is a defect in the wall of the abdomen. So you have to address that defect, or you have to close that defect, and you have to strengthen that defect. So the only way that you can address this problem is by means of an operation. There is no role for medical management for hernia. In terms of lifestyle, some people do think if you do exercise, that will strengthen the muscles and that will prevent the hernia. But in fact, exercise will not cause a hernia as such. But if there is a pre-existing hernia, whether it is inguinal or whether it's a groin hernia or with the abdominal hernia, because of the strengthening of the surrounding muscles, this actual hole may get worsened or may get bigger, and the hernia actually gets bigger. So though it doesn't actually cause hernia, but that it will increase the size of the hernia, or chance of complications are more when you put more stress on the abdomen in a case where there's already an existing hernia.
So doctor, you made it very clear that surgery is the only way to treat a hernia.
Yes.
In that case, what is this hernia belt that we're hearing about?
The hernia belt is the one that is being advocated in the past, but that actually should not be used. In fact, the hernia should be reduced. As I told you, the hernia comes out, the bulge comes out through a defect. You have to push it back inside the abdomen and then put a belt on the top of it so that it doesn't come out through that. This is only indicated in those people who are really not fit for surgery, or they've got some symptoms, they want to take some time, like after 2 or 3 months they want to do the hernia repair. So as a bridging in between to control the symptoms, you can use a belt. But the most important thing when you use a belt, the hernia should be completely reduced. Suppose if you use a hernia belt, which is commonly called as a truss, if you use this truss on a hernia or a bulge which is not reduced, so actually you are increasing the chance of compression or you increasing the chance of lack of blood supply, cutting of the blood supply. So it becomes strangulated, it becomes gangrenous. So you are actually worsening by using a truss or a hernia belt. So it is only advisable under supervision by a doctor, and routinely it is not recommended.
Let's take a short break on SLG Hello Doctor.
ప్రపంచ స్థాయి మల్టీ సూపర్ స్పెషాలిటీ హాస్పిటల్ SLG Hospitals.
4 ఎకరాల సువిశాల ప్రాంగణంలో 999 బెడ్ల సౌకర్యంతో గ్లోబల్ JCI అండ్ NABH ప్రమాణాలతో అనుభవజ్ఞులైన వైద్య నిపుణులతో అత్యంత క్లిష్టమైన గుండె సమస్యలకు శస్త్రచికిత్సలు చేయబడును.
మెదడు మరియు నరాల సంబంధిత సమస్యలకు మొట్టమొదటిగా న్యూరో నావిగేషన్ టెక్నాలజీతో చికిత్స.
క్యాన్సర్ చికిత్స కోసం లీనాక్ వంటి అత్యాధునిక వైద్య పరికరాలతో చికిత్స.
కీళ్ల నొప్పులు, ఎముకలకు సంబంధించిన సమస్యలకు మరియు జీర్ణకోశ సంబంధిత వ్యాధులకు మెరుగైన వైద్యం అందించబడును.
20 అత్యాధునిక ఆపరేషన్ థియేటర్లు, 200 ICU బెడ్స్, అత్యాధునిక డయాలసిస్ సదుపాయం కలదు.
24 గంటలు ఎమర్జెన్సీ, డయాగ్నోస్టిక్, ఫార్మసీ సేవలు.
3 టెస్ట్ల MRI, CT స్కాన్ వంటి అత్యాధునిక వైద్య పరికరాలతో మరింత మెరుగైన సంరక్షణకు మీ ఎంపిక SLG హాస్పిటల్స్, నిజాంపేట్ రోడ్, బాచుపల్లి, హైదరాబాద్.
సెల్ నంబర్స్ 9133395500.
ఫోన్ నంబర్స్ 914023785678 మరియు 48525678.
టోల్ ఫ్రీ నంబర్ 1800599220.
ఎమర్జెన్సీ 7799235678.
ఆంధ్ర ఆరోగ్యశ్రీ సదుపాయం కూడా కలదు.
Welcome back to SLG Hello Doctor, where we are talking to Dr. Tagore Mohan Grandhi, GI, General and Laparoscopic Surgeon at SLG Hospitals, Hyderabad, about hernias. Doctor, so what are the various kinds of surgeries that are advised for hernia repair, and is there a minimally invasive version available?
That's a good question. As I mentioned before, the treatment for hernia is always surgical. That means you have to address the gap, you have to address the defect, that is the hole in the abdominal wall. How do you do it? Is you can do by open method, which is a classical method, or you can do by laparoscopy, or you, as you just mentioned, it's a minimally invasive method. In open method, you are actually cutting, closing the defect and reinforcing with some sort of a mesh. That means a plastic material. In laparoscopic method, the same surgery is being done by means of a small cuts. So the advantage means instead of giving one big cut of about 10 centimeters, you're giving 3 to 4 cuts of about half centimeter, one being about 1.5 centimeter. With the smaller cuts, doing the same operation, the recovery time or the pain, discomfort, or the chance of infections, or these are less. So as you rightly mentioned, minimally invasive method is the best method, or the laparoscopic method is the best method, which has got much advantages, faster recovery, less complications compared to the open method.
Doctor, is the treatment same for all sizes of hernias? Because if the hernia is larger, will a minimal invasive method work?
Actually, there are two things what you have to look at. As I mentioned before in the investigations, what is the size of the hernia? Talk about abdominal hernias. If it's a small hernias, you can do it laparoscopic, or even bigger hernias, you can still do laparoscopic. But sometimes in some conditions, say for example, the defect is, or the muscles are too wide, more than 10 centimeters apart. Basic principle of the hernia is you have to bring back the muscles together and reinforce with the mesh. So when you are bringing the muscles which are about more than 10 centimeters apart, you are creating a lot of tension. In these cases, it is better to go for a open method. There is this advanced technique called a component separation, where you actually release the muscles, bring the muscles tension free into the midline, and then reinforce with a mesh. So in these giant hernias, what you call as a giant hernias, it is better to go by an open method by means of component separation, whereas other set of less than 7 centimeter defect, you can always do by laparoscopic method.
Doctor, let's say you've opted for the minimally invasive method of surgery, and as you go along, you figure out that it is no longer possible or viable. In that case, can you switch over to the traditional method?
Most of the times when you plan for surgery, whether you want to do it by open method or laparoscopic method, majority of times it is possible to decide pre-op. We do plan by pre-op depending upon the size of the hernia, whether it can be done open or laparoscopic, or whether it needs any particular release. Say for example, we think it can be done laparoscopic, and when you start laparoscopically, In these conditions, as bleeding or adhesions, where one cannot complete the procedure by laparoscopic method, in the best interest of the patient, you should always do it by, or you should always convert into open method. So you're doing for the sake of the patient. This is not a complication. One has to remember this.
Doctor, is there any possibility of complications arising from the surgery?
Most of the times, hernia operation is without complications. For any surgery, you can have complications. The simple complications being infection or bleeding. And the other side is long-term complication. What is a long-term complication? Is recurrence. That means when you repair the hernia, you close the hernia, it is fine for a few years and it has come back. Again, so what are the chances of the hernia is coming back? This is called a long-term complication or a recurrence. The tension-free repair is the solution for the hernia repair. That's the reason you have to use a mesh to reinforce the tissues without tension, without causing the long-term complication of recurrence.
What is the post-op care that needs to be taken by the patient and those attending to the patient?
There's nothing too much of care for this patient. Usually you have to keep the cuts or the wound clean by means of a dressing. And most importantly, particularly in the case of open hernia, you have to avoid exercise. Anything that puts pressure on the abdomen should be avoided for about 4 weeks. This is not an absolute requirement for a laparoscopic method, but for open hernia, because it's a big cut, because there is a weakness in the abdominal wall, one has to avoid putting pressure on the abdominal wall for about 4 to 6 weeks. Apart from that, there are not precautions that need to be taken after surgery.
Doctor, we generally hear that hernias occur in males only, but we also know that it occurs in women also. So can you tell us what kind of hernias actually women are prone to develop?
Actually, whether it's a male or female, both can get hernias. As I mentioned before, the inguinal hernias, also called groin hernias, are more common in males. Why? Because, as I told you, there is a connecting channel between the abdomen to the scrotum. Through this, the hernia develops in males. So that's why the inguinal hernias, otherwise called groin hernias, are common in males. Another hernia called a femoral hernia, which is slightly below the inguinal hernia, this is more common in females. So when it comes to abdominal hernias, particularly people or female patients who had previous surgeries like hysterectomies or cesarean sections or any other surgery, the chance of developing hernia is more. So you can say probably the incisional hernias or the hernias resulting from a previous operation is more common in females compared to males. But as a whole, hernias can occur in both males and females.
Thank you, Dr. Tagore, for talking to us about hernias and taking away some of the misapprehensions that we had about hernias. Do you want to leave our viewers with a parting message?
The first most important thing is don't ignore any bulge. See, you may think it's a simple thing. So first of all, it may be hernia or it may not be hernia. Whenever you see a lump or a swelling, it could be something serious or it could be something very benign conditions or innocuous. So always consult a doctor whenever you have a bulge. That's first thing. And second important thing, once it is confirmed it's a hernia, try not to put excessive pressure on the site of the hernia and always try to push it back when you lie down. So by increasing the pressure in the abdomen, you're increasing the chance of complications. So the two important messages, one is consult the doctor, second is don't put pressure on the abdomen. In a case already diagnosed we have hernia. Thank you.
We'll be back with you in 2 weeks from now with yet another topic of great relevance and yet another healthcare expert. On behalf of the teams at SLG Hospitals Hyderabad and SLG Hello Doctor, I wish you and your loved ones a very happy, vibrant and prosperous Sankranti. Namaste. Viewers, don't forget to hit the bell icon to keep yourself updated on all that's happening at SLG Hello Doctor.